This is Akashvani. In the program Spotlight, now we bring you a discussion on health priorities under India's presidency. The participants are Dr. Narendra Saini, former Secretary General, Indian Medical Association, and Ishan Mittal, anchor.
The third meeting of the G20 Health Working Group took place today in Hyderabad, where participants discussed adequate emergency response preparedness since the risk of pandemic was not over yet. To discuss the health priorities under India's G20 presidency, we have with us today Dr. Narendra Saini. Sir, I wanted to understand that there are several priorities that have been laid under the G20 presidency for Health Working Group. Among these, one of the first is access to medical countermeasures. Could you elaborate on that point?
India has given a slogan, our Prime Minister has rightly said so, that Vasudhaiva Kutumbakam means, if in English I translate it, one earth, one family, one future. Means all our health-related issues are not now only it can be in one country. They all are together. Our health, human health, animal health, plant health, environment health. They all are interlinked to each other. And secondly, they are not now related to one country. These are all international. They are linked together also. So that is the most important part, that we all have to work together. And pandemic has also shown when all the countries have come together, we have overpowered the disease. The same thing India is propagating, that this is one earth, one family, and one future. So we all have to work together. And in these, there are three important agendas, which are today very pertinent to the health of the whole world. One is the climate change, which are bringing these kind of diseases. So we have to prepare for all health emergencies. For future, we have to foresee the future and prepare for that. And second most important thing which is coming globally is antimicrobial resistance. If nothing happens, then antimicrobial resistance is the pandemic which can come in future. Every scientist, every healthcare worker is perceiving that this can be another pandemic if we have not taken the right step. And this right step will not be only pertinent to one country. The whole world has to come together for the judicious use of antimicrobials, and secondly for research on antimicrobials, because that is a costly research. If the countries do not pool all together their resources, and G20 is a big forum because 2/3 of economy where the research money is required, G20 is the most powerful in terms of economy, and secondly, they are also having 80% of the population. So whatever any global calamity will come, it will affect all these countries. Good point is they have the resources also. So these have to put together. So our Prime Minister has rightly said so, one future, one earth, and one family. Then second part which is important is, we have, again I come to COVID, the lesson learned from COVID is that diagnostics is very important. Unless until we diagnose the disease, we can't talk about the future planning, we can't talk about the preventive measures, we can't talk about the treatment. So we all have to put our resources in terms of diagnostics. The therapeutics means treatment part. We all have to collaborate together so that in case of emergencies, the response time is not there. At that point of time, all our scientists work together, the solution will be much faster. That has been shown in COVID. And preventive measures, vaccine, that's shown any country can do that. India has shown the world that in the shortest possible time, we have produced a vaccine that was not costly, and we have given to the world also. So that collaboration is required, and scientific knowledge sharing is also required. Then the digital health. That has, I think, revolutionized the treatment part, revolutionized the preventive part. So these all important agendas are there, which our health team, our country has given this in G20, and they are very important. I think taken care of, we can be very sure of the health of the all countries who are in this group.
Could you talk about how India took the leadership when it came to providing COVID vaccines, as well as in terms of creating the CoWIN platform, and how these can be transferable to the world in terms of preparing for emergencies and scaling up operations, and also for broader universal health coverage?
You know, during these kind of emergencies, when the pandemic comes, as I said before, the important thing is that vaccination, preventive measures. One is a diagnosis, as I said before. The second, the most important part is the vaccination, and that has to come fast. If you go in the history of vaccination production, it takes 8 to 10 years to produce one particular vaccine, and sometimes it takes more. But India produces that vaccine, or other countries also, I will say, have produced this vaccination in 6 months to 1 year of time. And that was it only happened because of a collaboration and because of the scientific research which is available in our country. I really appreciate our country's scientists and the platform which was given to them. Government also has given the platform to our scientists to work on this vaccination platform, and that's how we are able to produce fast. And then this CoWIN platform has helped us in distribution and giving the vaccination. That is also important. You may have a vaccination, but at the right time, right people, right dose is not given. This is of no use. We made a platform, our scientists made that platform, we use in our country, we found that it is very effective, and rather now we are giving to WHO, sir. We're giving that take this as a digital box from us and use this platform for any other country also, so that effectively we can utilize our vaccination program or any other program which is required to have a digital platform where it is needed.
Next, I would like to ask you that how has India's history of vaccine production, especially with respect to smallpox, etc., and now COVID, helped it to become pertinent advocate for, such preparedness for vaccine rollout, etc.? Could you shed some light on that?
Vaccination is all preventive measures. And vaccination, I take you back to history of polio eradication. What a platform it was. I think all Indians should be proud of that. In no time, we were able to curtail polio. We eradicated polio. We produced vaccination, we manufactured it, we distributed it. Vaccination is not only making a vaccination, it is then distribution, temperature, making a controlled temperature, garrison for the transport, maintaining that cold chain when it is required. All these requires a lot of dedication and scientific research work that we have been able to produce. Manufacturing and vaccination is one. Second is maintaining that cold chain. Then third is the distribution of the vaccine at the right time. These three chains are together, and our scientists have worked on each and every area of this manufacturing of vaccine. We started preparing. I will really again congratulate our government which promoted the scientific research on vaccination. So we were able to produce vaccination. Otherwise, the cost of this polio or other vaccination would have been very high. The COVID vaccination which we make was affordable. So government also gave to our people free of cost also. But the vaccination which is produced by the Western countries in USA, UK is very high cost, which we could not have been able to afford it. So local manufacturing was very important. Local research was very important that helped us in manufacturing our own vaccine. So first is making a vaccination platform. Then second is making distribution platform. Third is local level making a platform so that vaccination can be stored effectively. And fourth is using a digital platform so that we are able to give vaccination to right people at the right time. So these all four, I think, has really helped us in effectively controlling most of the effective diseases which are at present prevalent in the country. And I think G20 is a great platform to share that knowledge. Now the time is that we should share that knowledge so that other countries can take help of that and can manufacture in their own countries and become a cost-effective thing. Similarly, I want that other developed countries should also share that platform with other countries like India, where we have the platform to manufacture. Only thing that scientific know-how for that particular disease is not there, so that we are able to this. So intellectual rights, India has rightly talked about intellectual right also. If somebody is making a drug or somebody is only having that knowledge of producing a vaccination, there should be some intellectual right and technological transfer should be there, so that the dream which we have is one earth, one nation, one family, it can be, I think, come true.
India is considered the pharmacy of the world. How does it place the country with respect to the G20 agenda of One Health framework, of strengthening cooperation in pharma sector as well as access to affordable medication?
You have taken asked me a very right question. There are two aspects into this manufacturing of drugs. One is manufacturing. Second is the intellectual right to manufacture. These cooperations are required. Wherever these intellectual rights have gone, we have way ahead from other countries. We are producing these pharmaceutical drugs there is no intellectual rights at a very minimal cost, which is helping. Rather, USA and UK, we are exporting these drugs at a very nominal cost, which they can't even think of. So another cooperation which India has rightly said so, that intellectual rights also should be taken into consideration. You can give these drugs in a collaborative manner so that these intellectual rights should not come in between this. India has the technology to produce, manufacture and help other countries also to do so. But we need also help like the intellectual rights. So G20 is a great platform. We have the leadership to impress upon people that yes, we should also deliberate on intellectual rights and technology transfer.
Could you also talk about the aspect of medical travel, medical value travel, medical tourism as it is called generally, and how that can be a driver of this One Health initiative across especially G20 countries, with India being a center of it?
As we said, we want no person should die from want of health. There are few countries where the cost of medicine very high. If I talk about developed countries, USA, UK, the expenditure for a normal person to bear that expenditure is too high. India has now the hospitals, India has now the expert, and India has the medical atmosphere which is required to treat those diseases. It is all there in terms of diagnostic facility, in terms of equipment. So we have all those things and we can do it at a much lesser cost. And that has really promoted health tourism in our country. So this is again, sharing that knowledge is very important, that if you can't afford in that country, you can come to a country which can give you a platform like India, where we have now the best possible experts, best possible equipment, best possible hospitals to take care of high-end diseases where the cost is very high in other countries. Not only from developing countries, people are coming to India, but from the developed countries also, like US, UK, I am saying again, they are coming to India for that quality treatment in our country.
Another pertinent question is India's vast knowledge reserve in terms of traditional medicine. How can this be harnessed by G20 to create a wider platform and a wider understanding for this kind of traditional, sometimes even non-invasive therapy?
So for this, I think more research is required, because when we are talking to the world, it has to be evidence-based. It has to be scientifically based. And there should not be any mixture of two pathies, because that even we do not know how much it affects. Yes, yoga, one, which we are saying, which we are propagating it also as one of a very preventive measures for so many diseases which can happen. You take effective yoga exercise, but has to be based on scientific people. That first we have to create atmosphere or expert like we have produced experts in medical field, which are validated by MCI, Medical Council of India. I think we should propagate. People have accepted yoga. It is a scientific, simply for other traditional values, which we see that you do not need an operation. More scientific research is required. More scientific people, knowledgeable people in that directions are required, which only government can do it, and that way we can really help propagate this kind of medicine or this kind of traditional medicine to the world. But more, I think, scientific evidence-based research is still required in that field.
What is the role of climate change on global health, and how can that be mitigated by this group?
That is a big issue. Even COVID, we are perceiving because of the climate change which has happened. We are seeing global warming is happening. Why we are taking One Health approach? Plantation, animal, birds, all these are migrating because of these changes. And when this migration is happening, they are coming more in. There are certain animals, there are certain insects, there are certain other things which are not in contact with humans. They are coming into contact with us. What kind of disease they can transmit to us, we do not know, because we have never been exposed to such kind of a microflora. Climate change is a big issue. We have to do it more scientific work on that. Then environmental pollution, which also comes into that effect. So many things are required, and people knowledge is also important.
Thank you so much for your time, Mr. Saini.
Thank you.
You were listening to a discussion on health priorities under India's presidency. The participants were Dr. Narendra Saini, former Secretary General, Indian Medical Association, and Ishan Mittal, anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 928 909 4044.